of Baxter in Saudi Arabia. Whenever you have questions, never hesitate to interrupt. I'll be glad to answer all of your questions. And today we are going through the training of the CRT, CRT on Prismax machine. So for sure, why CRT? Because this machine can do multiple. So it can do CRT, PPE, CO2 removal, endotoxin removal, and multiple things. So we'll go through the CRT today, standard CRT. We have also citrate CRT, but we'll go through the standard CRT. Okay. CRT, continuous renal replacement therapy. Well, what do I mean? It means, so for patients in ICU who already lost part of their kidney function, we have to support them, because if they were not supported for their kidney function, they may lose all the kidney function. So they will be chronic patient, and there is no hope for recovery. Okay. So we will do CRT. So it's continuous treatment. It means it is meant to be more than 24 hours. So we can do CRT for 4 hours, it's fine. But it's not significant, because this machine is very slow. So to be significant treatment, we need to give a treatment by definition of more than 24 hours. So it's continuous renal replacement therapy. It works at the same speed as the kidneys, same speed, okay? Almost the same speed. Unlike the conventional hemodialysis machine, which is very tough. It is very tough. For chronic patient who already lost their kidney function, we do like 4 hours every 2 days. 4 hours of treatment every 2 days. So those 4 hours should cover the patient for 48 hours, for 2 days. So it works in very fast and very tough way. Unlike this one, it meant to be used for patients in ICU who are hemodynamically unstable. So it works slowly and gently. What do I mean by slowly and gently? While this machine is removing waste, it removes waste gently from patient blood. When we remove fluids, also it removes fluids in very gentle way. Example, so when we remove fluids on this machine, we remove like 100 ml, 150 ml per hour. The other machine, conventional hemodialysis machine, in average we remove 1 liter per hour, half to 1 liter per hour. For some patients, if they are stable, also we can remove more. Okay, so this in terms of fluid removal. In terms of waste removal, it's the same. When we talk about waste removal, we will talk about the fluid flow, because the fluid flow here, the fluids that we are using, is responsible for waste removal of from the patient, from the blood of the patient. So the fluid flow here in CRT machine is around 2 liters per hour. The conventional hemodialysis machine, it's half liter per minute, so it's around 30 liters per hour. So if you compare 2 liters per hour with 30 liters per hour, it's like 15 times more, at least 15 times. So this machine works slowly and gently for patients in ICU who are hemodynamically unstable. If those patients in ICU are hemodynamically stable, it's fine. We still can use this machine, but we also can use the other machine, the hemodialysis machine, because it's less expensive. Okay, so we can use it. If you want to save cost, we can go for the conventional hemodialysis machine if the patient is stable. Unstable, we have to go to the CRT. So both machines work with the same principles, exactly the same. Okay, same basics. The only difference between this machine and the other machine is the speed, as said before, is the speed. So why the speed? Because the flow rate here again is low, the flow rate there is very high. Technically, in terms of hardware, this machine we can use bags, because if the flow rate here is 2 liters per hour, it's fine. We can use fluid. We can use those bags. It's a 5 liter bag, 2 liters per hour. We can afford to use bags. But if we have 30 liters per hour, not for one machine, but for 10 machines, example in the clinic, so bags will not be enough. So we will have a big machine, RO machine, central water plant, which will prepare those fluids for us, and it will feed the whole clinic, like 10 or 20 machines, sometimes more. Okay, so this is the only difference between the two machines. The rest, basics, what I will explain now, exactly the same. Both of them will work with the same basics. Deal? Okay, so patients with AKI, acute kidney injury, lost part of their kidney function, so they have decreased urine output. Decreased urine output, it means accumulation of waste and fluids in their blood. So our objectives is fluid removal and waste removal. Deal? Okay, so fluid removal, waste removal. Under waste removal as well, we have sub-objective of correction of metabolic acidosis and correction of electrolyte imbalance. Okay, so let's start with objective number one. How we will achieve our objective number one, which is fluid removal. Okay, so before we go how to achieve it, we have to understand this, the dialyzer, because the machine itself, it's only pumps and sensor and screen and whatever. But the artificial kidney is here. Where we remove fluids is here. Where we remove waste is here. So this is the artificial kidney, not the machine. Again, this is it's a machine, not more. But this is the artificial kidney. So to understand how we remove fluids and waste, we should understand the anatomy of this dialyzer. And it's very simple. Remember, the red line is axis. This is where we get the blood from the patient. So we get the blood from the patient, it will go inside the dialyzer. Inside the dialyzer, inside the fibers. Inside we have thousands of fibers. The blood will go inside the fibers. And it will go out from here. Blue is the return, going back to the patient. Okay? So inside the artificial kidney, back to the patient. Okay? So compartment number one inside is the blood compartment, which is the compartment inside the fibers. At the same time, we have the space around the fibers, which is a fluid compartment. Compartment number two. So we have compartment number one inside fibers,